Earlier this week, the CDC reported a major spike in flu cases, not just here in our county, but across the country as well. And experts believe it's really because the majority of Americans don't have their flu vaccine. Flu vaccines are down compared to recent years. There's only 44% of Americans getting their shots. Also, according to the CDC, in Maricopa County right now, flu and RSV is spiking while COVID rates are declining. This is forcing some hospitals in other states to reinstate their masking policies. For example, New York City is requiring visitors at its 11 public hospitals to wear them. In both LA and Massachusetts, similar measures were also taken. Here at Phoenix Children's, no masks are required, but its visitation policy has tightened since December, with no one under age 12 permitted to visit a patient in their room. Dr. Wasim Balan, an infectious disease specialist at Phoenix Children's, says it's still a good idea to go ahead and get your vaccines, and while the surge lasts, you might want to consider wearing a mask.
We have to remind people that masks are still very effective at catching all those droplets that we're releasing if we're sick. So even if they might not be the perfect, protection tool to avoid the person getting infected, they're still effective at containing, those droplets that are released by someone who might be infected with one of those viruses.
The good news here is that the spike is only expected to peak and then drop off by the end of the month. So we could be out of the woods a bit soon, though we do have a ways to go. Doctors are also keeping a close eye on the JN1 new COVID variant, which is thought to bring on more serious symptoms, though it hasn't been as deadly as other strains of the illness in the past. I'll send it back to you.